We begin your technician training by examining what's different about working in healthcare. In a word, patience. Working in healthcare facilities is unique and complex, a 24/7 operation. You'll be going to a healthcare facility to provide a variety of building or equipment services. Your actions and those of your team will either have a positive or negative impact on the healthcare staff, visitors, or most importantly, the patients who are being treated there. While some of those patients are mobile and relatively healthy, others are not able to move around freely on their own and may have immune systems that are weakened or compromised by their illness and treatment.
A primary purpose of this training is to equip you with the knowledge of the uniqueness of working in healthcare so that your subsequent work performance will result in a positive impact on the occupants of that facility.
Building and equipment services in a healthcare environment can often lead to dissatisfaction among patients and patients' families. Just like we want the best care for ourselves and for our families, patients and their families demand high levels of care and professionalism during their treatment in a healthcare facility.
It is important that you understand that your actions directly impact the patient's comfort and health during their stay.
Building and equipment services in a healthcare environment can often lead to dissatisfaction among the healthcare staff too. The healthcare staff may become quickly frustrated during such services if healthcare technicians are not properly trained to work in a healthcare facility.
Remember, if you disrupt a facility's ability to properly care for patients, it is likely you will be asked to leave the worksite and your employer may lose the job.
The best way to avoid negative results during work in healthcare is pre-planning. On building and equipment services projects, this pre-planning process is called PICRA, or Pre-Construction Risk Assessment. A PICRA is designed to protect patients from risks in the building through the assessment of the following 7 categories. 1. Noise. 2. Vibration. 3. Air quality. 4. Interim life safety measures, or ILSM. 5. Infection Control Risk Assessment, or ICRA. 6. Emergency procedures. And 7. Utility failures.
Let's look at one particularly disruptive part of building services: demolition. During demolition, dust and debris is often present in the air. The air moves throughout a building and can negatively impact patients who breathe in that air. A PICRA will address this potential problem before a building services or construction project begins and will assure that measures have been put in place to protect patients.
What kind of air quality measures might be included? The PICRA might address how often air filters should be changed during the demolition and other phases in the construction plan, or where, when, and how isolation systems may be required or used.
A PICRA will also protect patients from unplanned power outages. If an unplanned power outage occurs, ventilation and water may be compromised, posing an infection risk for many patients. A PICRA developed prior to beginning a building services or construction project will have a contingency plan in place in case such an outage occurs.
The movement of debris during building service or construction projects is a common source of infection exposure within a healthcare facility. This is another example of how a PICRA, when completed prior to the start of a building service or construction project, can protect patients.
Consider this. While working on a project at a healthcare facility, you must move debris from a demolition site to an outside area. The debris can be moved in any manner and at any time during the normal 8 a.m. to 5 p.m. workday, right? Not necessarily. A PICRA may specify how debris should be moved in a covered wheeled container, for example, and when debris should be moved. After 8 p.m., for example. Now, listen to the following scenario and try to predict what might be included in this PICRA.
You're working on a demolition project on the 3rd floor of a healthcare facility. The surgery center is located on the 2nd floor. In this healthcare facility, surgeries are performed between the hours of 8 a.m. and 6 p.m. Did you predict that the PICRA would indicate that demolition activity should occur after 6 p.m.? If you did, great.
A PICRA can help plan for patient flow through a building that is under construction or building repair type services. moving patients between parts of a healthcare facility, to different floors within the facility, and even different rooms on the same floor can increase the risk of acquiring an infection. Facility staff must know which routes are available when moving patients, and a PICRA can provide that information. You have arrived at a checkpoint. These checkpoints are designed to quickly review the information contained in the module that you just completed. The scores to these quick checkpoints do not impact your final score on this course.